Imagine hearing your child say, "Mommy, I can't breathe." Well, we'll tell you how to cope with kids and asthma right now on Keeping Kids Healthy. Hi, I'm Dr. Winnie King, and I'm coming to you from the lobby of the Children's Hospital at Montefiore in New York City. So don't be surprised if you hear some ambulances or see some people strolling around in the background. It's all part of our world here. Now, you've all heard of asthma, and you may think of it as just a little trouble breathing, easily cured with an inhaler. But what most people don't realize is that asthma is not only the most common chronic childhood illness, it can and does kill. A serious asthma attack can be a parent's and a child's worst nightmare. Come with us as we relive one child's experience.
He's trying to ride the bike with his feet.
Yeah, but why that's not safe?
My name is Asthma. I'm 6 years old and I have asthma.
He was 6 months. I noticed that he was breathing funny. It scared me. I took him to the hospital and all the doctors came in, running in and stuff. When it first started off, sometimes I might be in the hospital 4 or 5, maybe 6 times a month.
It hurts a little, and I can't even breathe or nothing.
My grandfather had asthma real bad. He came home from work, just a plain day, working, sat on his porch, asked my grandma to get him a glass of water. She would go get it, came back, and he couldn't breathe, and he died on the spot.
I'm going to give you something to go with and I'll give you a prescription. Yes.
You stay away from cats and dogs and smoke, food, a feather, dust mites.
Because you have asthma and you can't be around dogs.
I don't like asthma. No, it ain't fun.
It's never a day off when your child had asthma. You have to check on him like 2, 3 times in the night. Sometimes I just get up in the night and just check on him for no reason because I'm scared. I'm scared.
Anthony Fogel and his mom, Natasha, are here with us right now in the studio, and welcome to the show. We're so glad to see you both here.
Thank you.
You know, Anthony, it is a little scary. Do you get scared and frightened from your asthma?
Yeah.
Yeah, it can be pretty scary. Natasha, do you think that most people sort of underestimate the seriousness of asthma?
Oh, yes, I do. A lot. A lot of people think, oh, he'll get over it, let him just play like a normal child, but he has a sickness and it's asthma. He can't play like a normal child. I have to keep my eye on him at all times because he has a breathing problem.
Yeah, it is a very serious problem.
It's very serious.
And unfortunately, a lot of people do sort of downplay it. You know, in my practice as an ER doctor, I've seen so many kids having asthma attacks, and it is true. People don't realize how scary it can be. But there is a lot that you can do about asthma, whether it's taking care of your own child who has it, or even knowing what to do if your child's friend has an asthma attack at your house. Now, we're going to find out all about that from 2 New York City pediatricians who specialize in asthma, Dr. Ben Ortiz, who works at Harlem Hospital, and Dr. Karen Warman from the Children's Hospital at Montefiore in the Bronx. Now, these 2 areas also have the highest asthma rates in the country, believe it or not. And welcome to the show, both of you. We're grateful that you're here today. Karen, when Anthony's having an asthma attack, what's going on in his lungs?
Well, his lungs are becoming congested. There's extra mucus that builds up, and in addition, the small tubes in the lungs clamp down, making it hard to breathe.
Yeah, it's really impressive to us as doctors, but a lot of people don't recognize what's going on. Now, there's actually 2 types of asthma. Make the distinction.
Yes, some children have what we call mild asthma that only happens when they have a cold or something triggers it, but they can be absolutely well in between. Other children have ongoing inflammation, ongoing irritation in their lungs. We call that persistent asthma. And those children need a daily medicine to control that. And with good control, they should be free of cough and wheeze.
I see a lot of parents that tell me, my child doesn't have asthma, but he has this reactive airway disease, where if he gets sick, you know, he'll have a problem. It's treated like asthma, but it's not actually asthma. What is that?
Yeah. I think any child that has recurrent wheezing or recurrent episodes of cough, like asthma, we have to kind of assume it is asthma and treat it like asthma. Sometimes people don't want to label it asthma.
Well, I think that's what's happening. A lot of doctors don't want to actually label a child as asthmatic, and so then they sort of come up with these other terms. But in fact, this is a form of asthma.
Yes.
Yeah. Okay, well, Dr. Ortiz, we have a straw here, and there's a reason for that. Tell us what the connection is between a straw and an asthma attack.
This straw, to me, represents the kid's airways, especially when they're having an asthma attack. As Dr. Warman just said, they clamp down. They get very, very small. Our airways are huge compared to this straw. Now, we can imagine Anthony, when he gets an asthma attack, having to take all of his breaths into this straw. That's essentially
so graphic. That's what it's like. And Anthony, is that what it feels like for you when you're having an asthma attack?
Yeah.
Kind of like you can't get your air, like it's really tight no matter how hard you try to breathe. It's a pretty scary feeling, isn't it?
Yeah.
Yeah. Now, Dr. Ortiz, is the diagnosis sometimes hard to be made with patients? I mean, is it ever missed by a pediatrician?
It's unfortunately frequently missed. ER doctors like yourself kind of pick up on them, but a lot of pediatricians out there, they get a child with a persistent cough. It takes a few months. Is it a cold? Could it be something that the child swallowed? More often than not, this persistent cough, especially a nighttime cough, is a sign for us that it's asthma.
Yeah. What are the symptoms that parents should be looking for to kind of pick up that this may be asthma?
They should look for a number of things, like a persistent nighttime cough, as I just mentioned, a cough or shortness of breath when the child is running around or playing or enjoying themselves. Maybe if they have coughing or respiratory breathing problems when they're around certain things like animals with thick hair or perfumes or cigarette smoke.
Yeah, and cigarette smoke is a really, really important trigger that we want to talk about because a lot of parents smoke and have children that have asthma. And we know that smoking also seems to have some role with ear infections, but in addition to that, asthma, it's a real connection. So if you are a smoker and you have a child with asthma, you are not doing them any service. First of all, you're not doing yourself a service as a smoker, but certainly you are really increasing the likelihood that the child is going to have a problem. There is a direct connection between cigarette smoke and asthma. I want to make sure for sure we can say that with confidence.
We can say that with confidence, that cigarette smoke is arguably the largest indoor exposure to children with asthma.
Okay. Well, believe it or not, as many as 25% of the children in Harlem have asthma. In fact, it's common for inner city children to have very high asthma rates. So many city hospitals have created support teams to help these families fight back against the disease. Let's take a look.
Mariana Sanchez and Sandy Claire Beal are a community worker and a nurse battling the asthma epidemic in Harlem.
In this building or this building? This building. We make home visits and we work with families and see them every 3 months, and we give them items that help them control the triggers for asthma in their apartments.
They visit people like Norma Vasquez, a grandmother responsible for 2 children with asthma, often bearing gifts like air purifiers.
I think going into the homes is extremely important because, first of all, I think that you relate to them so much better when you can appreciate and respect what they're dealing with on a day-to-day basis.
Mariana and Sandy are also here to help Norma make sense of the pile of medication the children must take, and to reinforce basics like how to use the inhaler.
Great job! Look at those breasts! Excellent!
The Vasquez family lives in one of New York City's huge public housing complexes, where asthma is rampant. Mariana and Sandy work for the Harlem Children's Own Asthma Initiative.
You take respire profundo.
One of the things they focus on is trying to remove the asthma triggers or activators that are particularly common in inner city environments. Contaminants like air pollution, cockroaches, and dusty carpets that cause asthma attacks in the children who live here.
In this project, every apartment has cockroaches.
In this project, every apartment has cockroaches.
Yes.
that you have to know what is there something in the environment that's making this child sick. And we have a family, for example, who had mold covering the entire ceiling of their bathroom, which certainly could be contributing to the child's hospitalization rate. So I think if you don't know that and you don't help families and intervene, the children just continue to be sick, and you can give them all the great asthma medicines in the world, but until you deal with the environment, it's just going to keep triggering the asthma.
For now, Norma Vasquez seems comfortable with the routine she must practice for the children's asthma. And Mariana and Sandy will be back to make sure.
Bye, Willie. See you.
Well, Ben, why does it seem that asthma is so prevalent in inner city environments?
Some of the exposures that happened in the inner cities are just really concentrated in certain areas. The South Bronx and Central Harlem and East Harlem come to mind. Poor and old housing stock, exposure to mold and mildew, roaches, vermin, pests, dusts, even animals that they keep as cute pets at home also are triggers. And if they all are concentrated in smaller areas, smaller apartments that are overcrowded, these are all concentrated and cause asthma symptoms.
Yeah. You know, Karen, parents often feel somewhat powerless with asthma, but there are really a lot of things that they can do to help control their kids' asthma. Can you go through that for us?
Yes, well, we have very effective medicines for asthma as one part, but before the medicines, we want to try to see what's at home in the environment and try to eliminate things that can be irritating the lungs.
Yeah, and triggers is the word that we often use for that.
Absolutely. As was mentioned, things like dust mites, cockroaches, exposure to smoke, these are all things that we know can irritate lungs. Yeah. Aside from trying to remove those things, parents can go to an allergist and have the child allergy tested to see specifically what things they're allergic to.
Okay. And if you know that your child is allergic to a specific thing, can they get allergy shots or something?
Yes, for certain things like dust mites or cockroaches, you can get a series of shots so that the body learns to recognize it and not overreact.
Get so excited and
exactly.
cause this attack. You know, Ben, a lot of adults will say, I had asthma when I was a kid, but I don't have it anymore. I outgrew it. Do people outgrow asthma?
People do not outgrow asthma. They learn how to control all of the exposures and the triggers we just mentioned. As they get older, they learn what their symptoms are and what their symptoms are triggered by. And I hope in a few years that Anthony will be able to learn. He already knows what some of his triggers are. He will learn better how to avoid those things so he can continue to run and play and be a great little boy.
Well, we certainly hope so too, because we know that you have a lot of things that you want to do in your life. You know, asthma does tend to run in families, so having a parent with asthma can increase a child's chances of having it too. And more than one child in a family may suffer from asthma. When that happens, it can take over a parent's life, as we see in this story through the eyes of one asthma mom.
My name is Sandra Fusco Walker, and I have 3 kids who have asthma.
An asthma attack is possibly the scariest thing. First, it starts to feel like someone's hammering on your lungs, and then slowly it's like someone's suffocating you.
In the beginning, you're terrified. When you find out your children can't breathe, it's scary. To watch your child gasp, you know, I used to say my kids had this guppy look. They, you know, pulling for air that they couldn't get, or their fingernails and their faces would turn gray. It's frightening. And as a parent, you feel almost inadequate because you're supposed to be raising these kids and taking care of them, and here they can't do something as simple as breathe.
We also have a sample of a nebulizer here on the counter, and this is the machine that makes a mist out of the medication.
You're feeding them all these medications and they're bouncing off the walls because sometimes it just makes them hyper, and other medications put them to sleep in the middle of the day, and you're trying to gain this balance. You're afraid every time they go to somebody's house. Do the parents smoke? Do they have a cat? What if they have an attack? Will they know what to do? And the smarter I got about what to do with asthma and allergies, the healthier my kids got. You need to teach your kids because they do grow up and leave home, and they take their asthma or their allergies, you know, with them.
I can't have carpets, down comforters, a lot of dust, anything that's really just going to affect my asthma. I just keep it out.
It certainly gave me an appreciation for healthy kids and for being organized. And it's taught me that you need to take control of your own health.
And welcome to Sandra Fusco Walker and Shannon Walker, who were on Keeping Kids Healthy a couple of years ago and came back to tell us how they're doing. Welcome to the show. It's great to see you guys again.
Good to see you.
Well, Shannon, I understand that it's been quite a long time since you've actually had an asthma attack. What's that been like?
It's great. I love it. I mean, it's the best thing in the world for a kid.
Yeah, how has it changed your life? You know, because prior to that, having a lot of asthma attacks really changed the quality of your life. What's it like now?
Right now, all I do really is wake up 5 minutes before, like, normal kids do and take my asthma medication, and I go on like a normal child every day.
So simple, but yet it makes such a huge difference.
Yeah, it does, definitely.
You know, Sandra, you work for the Allergy and Asthma Network, you know, Mothers of Asthmatics, and you're a parent educator. You're very, very involved in this, and you've done a lot to help Shannon as she prepares to go off to college. Once you get done crying about the fact that she's going away to school, you know, that's another issue in and of itself, another show. But what have you done to help her prepare for her life outside of your home?
Right. I think the most important thing I've done for Shannon is teach her to speak up for herself, to own her disease and be able to take care of it and let other people know what she needs to stay healthy. And she's also learned to help friends who don't have the education that she's gotten. She's shared information. It's been very helpful.
Yeah, that's so good. And do you feel like you're ready to go? I know you're ready to go home, go out of the house, right? Kids are born ready to leave their homes. But do you feel like you're ready to deal with your asthma outside of your home with your mom?
Yes, definitely. I understand everything about it, basically, that I need to. And if I don't, you can always ask like a doctor.
Sure, yeah, like a doctor. Just ask one of those doc people. Just see what they have to say about this, right? Now, Sandra, you actually have implemented an asthma action plan.
Absolutely.
And tell us about that. How has that worked for Shannon?
The Asthma Action Plan is a great tool that we got from our physician, and we shared it with everybody through all her years, with the school nurse, the coach, babysitters that she were with, family members, and it tells everything that people need to know to help her, and tells her what she needs to know. When she needs medication, what her triggers are, what her symptoms are. It really makes it easy for you to open the door at 2 in the morning and look on the bathroom shelf and say, okay, this is where I am and this is what I need to do.
Yeah, and Ben, what should be on an action asthma plan or asthma action plan? What does that mean? What do you need to have on that?
It's a written management plan, and I use it as a device to eliminate memorization.
Yeah,
it's
and
a
we've got
way,
one here.
if I may, a way to separate out, like a stoplight, when children are good, if they should be taking any medications to prevent their symptoms, if they start getting sick. This is usually the rescue medication area, what their symptoms are like. Should they be calling their doctor? They should be calling their doctor. It's at this point to make sure that they don't need to add anything else to it, and the danger area in which you need to take even more, either other or more medications, and urgently go to the doctor or to the emergency room for further care.
That really kind of makes it very clear.
I think it's very clear, fairly simple, regardless of the doctor's handwriting skills, but just to make sure that everyone can read it.
Yes, absolutely, and everybody's on the same page. Karen, from your standpoint as a doctor, what are the benefits of this plan?
I think it's important. It gives the parent and the doctor a chance to talk about it and really make sure things are clear. And since the family's so important in making the plan, since they're going to be the one giving the medicines, you really want to make sure that you discuss it and the family understand it and it's something that they can follow.
Yeah. Shannon, how practical has this been for you? I mean, it sounds all well and good, but you're a young woman. You've got other things to do. You've got places to go, people to see. Have you been able to actually use this?
Yeah, I've used it a lot actually when I was younger, but now that I'm older, I understand myself a lot more. Like, I can understand when I'm having trouble with my asthma. I don't really need to look at it anymore, but it is always there as like a guideline of what you need to do for your asthma.
And I can tell you, as an ER doctor, it would be very valuable to me if I had someone coming in that was having an asthma attack and they had an asthma action plan, so we could sort of kind of figure out together where you are on that plan and what needs to be done. So it does sort of help not only with your communication with your doctor, but also when you leave town and you go someplace else. And that's something to remember. If you have asthma, you should bring that with you, because if, God forbid, something happens and you are having an asthma attack, you can show that to the doctor, and then they know what's appropriate for you, what needs to happen, so that we're all on the same page and we don't have any problems, because that can be a huge, huge problem. Karen, let's talk a bit about medications, because part of treatment is medications. What are the types of medicines that are used?
Well, there are basically two types. There are rescue medicines for when you're actually having an asthma attack, and those usually open the airways. And then there are medicines for prevention, and those are the medicines that keep the lungs quiet so they're not overreacting.
And those are the ones you need to take all the time.
Every day.
And those are the ones that patients often don't take all the time because it's really hard to do anything every single day, right? You know, and so when you have to do this all the time, and especially in young kids, it's tempting to kind of challenge the disease and sort of see what happens if they don't take the medication. And that's when a lot of them get in trouble.
Right. It's very important for a child who does need a daily medicine because it'll keep that child free of coughing every day, free of wheezing, let them run around and play like other children. And it also lessens the chance of having a big asthma attack if you're under good control.
Which we definitely don't want. Now, we actually have an inhaler here with a spacer attached. We're going to pass this on to you. I know you're very familiar with this, but can you just show us how you use that?
Well, basically, you take off the cap and you shake it to make sure all the medicine's all up. And then you press down and you inhale until you can get it all into your lungs. You hold it for about 5 to 10 seconds, and then you just exhale and take as many as it's prescribed to take.
Yeah. And explain the spacer. Why is that so helpful, especially for children?
Sure. Well, if you just had the pump, you could be spraying it in the air, on your tongue, but you really want to breathe it into your lungs. So when you spray it into this chamber, the particles are all in the air here, so they'll be breathed all the way into the lungs.
Oh, and this is really good for kids.
For kids, for adults, and for younger children, let's say younger than 5, it comes with a mask. So it's foolproof because it's attached on the face when you spray it. There's nowhere else for it to go but for the child to breathe it in.
And where do you get this? Can you just buy it in the pharmacy?
These are available by prescription. Many insurance plans, including New York State Medicaid, will pay for these. And they really are quite important to make, not only to get the medicine effectively, but to make it safe. Because the steroid medicines, which are very important to control asthma, you want to make sure that you're breathing it in and not just spraying it in your mouth.
Which happens if you don't use those.
Right.
Okay. Then if a child starts having an asthma attack, you know, whether you're the parent or if it's someone else's child, what's the first thing you should do?
Well, I think it's a 3-step process. I think it's making sure that you as the adult caregiver is calm, because that will lead to the child being calm. Hopefully beforehand, the parent and the caretaker would have spoken about the child's care in case of an acute asthma attack. If they feel comfortable teaching the other caregiver how to give the medication, then it's fine to give it. If not, they should call the parent.
Yeah, immediately, and kind of let them know what's going on. You know, all parents should always find out if any kid coming over has any health problems at all. Then plan ahead with their parents and make sure that kids with asthma have their inhalers and that they know how to use them. We've so many times found people behind the 8 ball. There's a problem and now they're scrambling trying to figure it out, and you've got a child that's and they can't breathe and everybody's panicking because there's nothing like watching someone who can't breathe. At what point though, Ben, is it time to go to the emergency room?
I think after 2 or 3 repeated treatments of a rescue medication, whether it's going to be as an inhaler delivery or by nebulizer, which is also a common way to give medications. If the 2 or 3 treatments do not help rather immediately, like within half an hour to an hour, then that should be a point where either the emergency services should be called or the child should be brought to the emergency room.
Right, and if there's any concern about airway, about breathing, then you do want to activate the emergency medical services system, the EMS. Call 911, get some help, because people have had trouble getting to the hospital in their cars, and then it's turned into a big, big nightmare. Sandra, what about parents who have kids that are going to school and the child needs an inhaler? They need to use it 2 or 3 times a day. How do you handle that in the school environment?
Well, we recommend parents go to school in August and speak with their school nurses and the teachers, coaches, anybody who's going to have contact with their children, and share the asthma action plan and show them exactly, you know, what their child needs and talk about symptoms. Not all states allow children to carry emergency inhalers. There is a bill on Capitol Hill right now that's going to encourage states to make laws, but right now New York, New Jersey, there are states that do have laws that say that children can carry their rescue inhalers, and that's the way it should be, because when you teach these kids to take care of themselves, they need to have that medicine on hand in their pocket in case of an emergency.
Yeah, okay, fair enough. We just got a few seconds left, Ben. A lot of parents are exploring alternative therapies now for asthma. Does acupuncture have any role in the treatment of asthma? Not
that we know of right now. It may pan out that way in the future, but all know that historically the medicines that are approved by the FDA and the ones that are prescribed by doctors regularly are the ones that are known to work.
Yeah.
It may turn out that other complementary therapies may work in the future. Those studies are being done right now, but we just don't know. So we don't feel comfortable using those other therapies for traditional asthma care.
Fair enough. Okay, Anthony, the big question, what do you want to be when you grow up?
I want to be a cop.
Want to be a cop? Well, I think you'd make a wonderful cop because you're a very, very bright young man. And you know that means, of course, that you have to study very hard in school, right? Are you a good student?
Yes.
Yes, and you study hard. Well, I have a feeling that you're going to do just fine, and I have a feeling you're going to do fine with your asthma. You're doing a great job with it, Mom. You know, to get more information about asthma, you can contact the American Lung Association, and their website is lungusa.org, or you can call them, and their phone number is 1-800-LUNG-USA. And you can reach Sandra's organization, the Allergy and Asthma Network, Mothers of Asthmatics, at their website, and that's aanma.org. Or you can call 1-800-878-4403. And you know, I want to thank all of you for being here on the show today. Asthma is a serious disease. It's a controllable disease, but it's critical that we develop these action plans, know what we're dealing with so that we can keep these kids nice and healthy. That's what we want. We'll see you all next time. Thanks so much for watching.
Ride the bike with his feet.
Yeah, but why that's not safe?
My name is Anthony. I'm 6 years old and I have asthma.
He was 6 months. I noticed that he was breathing funny. It scared me. I took him to the hospital and all the doctors came in, running in and stuff. When it first started off, sometimes I might be in the hospital 4 or 5, maybe 6 times a month.
It hurts a little, and I can't even breathe or nothing.
My grandfather had asthma real bad. He came home from work, just a plain day, working, sat on his porch, asked my grandma to give him a glass of water. She would go get it, came back, and he couldn't breathe, and he died on the spot.
I'm going to give you something to go with them.
Imagine hearing your child say, "Mommy, I can't breathe." Well, we'll tell you how to cope with kids and asthma right now on Keeping Kids Healthy. Hi, I'm Dr. Winnie King, and I'm coming to you from the lobby of the Children's Hospital at Montefiore, New York City. So don't be surprised if you hear some ambulances or see some people strolling around in the background. It's all part of our world here. Now, you've all heard of asthma, and you may think of it as just a little trouble breathing, easily cured with an inhaler. But what most people don't realize is that asthma is not only the most common chronic childhood illness, it can and does kill. A serious asthma attack can be a parent's and a child's worst nightmare. Come with us as we relive one child's experience.
He's trying to...
Congested. There's extra mucus that builds up, and in addition, the small tubes in the lungs clamp down, making it hard to breathe.
Yeah, it's really impressive to us as doctors, but a lot of people don't recognize what's going on. Now, there's actually 2 types of asthma. Make the distinction.
Yes, some children have what we call mild asthma that only happens when they have a cold or something triggers it, but they can be absolutely well in between. Other children have ongoing inflammation, ongoing irritation in their lungs. We call that persistent asthma. And those children need a daily medicine to control that. And with good control, they should be free of cough and wheeze.
I see a lot of parents that tell me, my child doesn't have asthma, but he has this reactive airway disease where if he gets sick, you know, he'll have a problem. It's treated like asthma, but it's not actually asthma. What is that?
Yeah. I think any child that has...
I'm a child, but he has a sickness and it's asthma. He can't play like a normal child. I have to keep my eye on him at all times because he has a breathing problem.
Yeah, it is a very serious problem.
It's very serious.
And unfortunately, a lot of people do sort of downplay it. You know, in my practice as an ER doctor, I've seen so many kids having asthma attacks, and it is true. People don't realize how scary it can be. But there is a lot that you can do about asthma, whether it's taking care of your own child who has it, or even knowing what to do if your child's friend has an asthma attack at your house. Now, we're going to find out all about that from two New York City pediatricians who specialize in asthma, Dr. Ben Ortiz, who works at Harlem Hospital, and Dr. Karen Warman from the Children's Hospital at Montefiore in the Bronx. Now, these two areas also have the highest asthma rates in the country, believe it or not. And welcome to the show, both of you. We're grateful that you're here today. Karen, when Anthony's having an asthma attack, what's going on in his lungs?
Well, his lungs are becoming congested.
You stay away from cats and dogs and smoke, food, a feather, dust mites.
Because you have asthma and you can't be around dogs.
I don't like asthma. No, it ain't fun.
It's never a day off when your child has asthma. You have to check on him like 2-3 times in the night. Sometimes I just get up in the night and just check on him for no reason because I'm scared. I'm scared.
Anthony Fogel and his mom, Natasha, are here with us right now in the studio, and welcome to the show. We're so glad to see you both here.
Thank you.
You know, Anthony, it is a little scary. Do you get scared and frightened from your asthma?
Yeah.
Yeah, it can be pretty scary. Natasha, do you think that most people sort of underestimate the seriousness of asthma?
Oh, yes, I do. A lot. A lot of people think, oh, he'll get over it, let him just play like a normal